I'm delighted to present our moderator for the next session. As Monica mentioned, Ms. Mariange Saracayao. She's the Managing Director of Resource Mobilization at Gavi, the Vaccine Alliance. Speaking of numbers, as Monica so kindly brought to us, under the leadership of Mariange, Gavi raised more than 10 billion for COVAX AMC, correct? And you had several senior positions, and including in negotiations for debt relief, and also you've been 15 years with experience in developing financing, especially with a very relevant role at the World Bank Group. So this tells a lot of what you said, of what you've done, and we are so honored to have you as our moderator for the next panel. Mariange.
Thank you so much, and it's really a pleasure to be here with all of you today. I think Monica touched upon very, very important issues, daunting, especially in the context of reconstructing after the COVID-19. So I really look forward in this panel to talk more about what have we learned, what can we do, how can we enhance better that collaboration between Europe and Africa to have a much better health architecture, to build forward better. I love that sentence. And really to be more resilient. And it's really actually a panel for action here, because we can all do it. We can, and we will. So I'm really delighted to be joined by an extraordinary panel, guest speakers. So I would like to call Dr. Magda Robalo Correa e Silva, Global Managing Director of Women in Global Health and former Minister of Health of Guinea-Bissau, and Mr. Luis Teles, Chief Executive Officer of Standard Bank Angola, and of course, Monica Ferro, who has just given us a very passionate keynote speaking. So before we dive into the discussion, I'm really delighted to first show a video from Dr. Lia Tades. Dr. Tades is the Minister of Health of Ethiopia. I'm very fortunate to work closely with her at the Gavi Board Alliance because she's really active. She has really taken on board the issue of bringing, better health system, of really acting so that, to increase, especially during the pandemic, access to essential services. So without further ado, we'll have a video from Dr. Lia Tades, and then we jump right in for our discussion.
Honorable Ministers, Your Excellency Professor José Manuel Barroso, Chairman of the General Assembly of the Portuguese Diaspora Council and Chairman of the EurAfrican Forum, Your Excellency Antonio Calcada Dessa, President of the Portuguese Diaspora Council, distinguished guests, ladies and gentlemen. First of all, I extend my sincere apologies for not being able to join you in person, but it gives me a great honor to share a message on this important gathering of the 2022 EurAfrican Forum that focuses on empowering EU-African alliance in times of disruption. Ethiopia has a long-standing partnership with the European Union in many areas, and in 2016, the European Union and Ethiopia have signed a strategic engagement which is strengthening our close cooperation in many areas. The EU partnership with Ethiopia focuses on Ethiopia's development strategy priorities, notably in the areas of food security and agriculture, health and governance, and in recent years it includes job creation, industrial and agro-industrial park developments, export and trade promotion, and private sector engagement. Foreign direct investment has also increased in the past years, and the European Union accounts for 23% of exports and 25% of imports, remaining the second largest trading partner in Ethiopia. With over 300 EU companies in Ethiopia, most of them are members of the EU Business Forum for Ethiopia, a fully fledged chamber of commerce set up in 2016 to facilitate operations for EU companies doing business in Ethiopia. However, these past few years have been challenging for all of us. The COVID-19 pandemic has disrupted the health systems and economies worldwide, particularly in low and middle-income countries. The pandemic has wreaked havoc on pharmaceutical supply chains over the past 2 years. However, these challenges have also provided us opportunities. The lessons we were forced to learn due to COVID-19, from the value of strategic partnerships at different levels to the importance of local manufacturing, have equipped us with new ideas and approaches to improving global, regional, and local access to crucial vaccines and pharmaceutical supplies for the duration of the pandemic and beyond. The pandemic has also triggered change to the ways healthcare system operates. Digitalization is one which is expanding as medical care integrates with ICT, and this transformation will reshape entire healthcare ecosystems. There are strong global and regional efforts to supply vaccines to lower-income countries, both in pre- and post-pandemic, particularly through Gavi, COVAX, AVAT, and others. But the fact that 99% of Africa's vaccines against all diseases are imported only highlights the fragility of supply chain in this region. Africa's reliance on donations has brought the continent's need for better domestic manufacturing capabilities to the forefront. To ensure secure supplies of essential vaccines, African countries must build the ecosystems for life science innovations at home. This should be one of the areas this partnership needs to address. The Pharmaceutical Manufacturing Plan for Africa was developed, and the African Medicines Agency has become operational since 2021, which promotes investments in pharmaceuticals in the continent. However, industry players and global organizations need to assist and empower countries in the global south to reach this goal. The EU-Africa partnership is a unique opportunity that will primarily benefit the people of Africa. However, it is a mutually beneficial partnership that will also directly and indirectly add value to the EU, and I am happy to highlight a few of those. The partnership is a demonstration of the EU's commitment to the health and well-being of Africa and its pursuit of the SDGs. The Global Action Plan for Healthy Lives and Well-being for All, launched at the UN General Assembly in September 2019, noted that extra efforts would be required if health-related SDGs are to be met by 2030. This partnership will open opportunity for addressing key global health threats such as antimicrobial resistance and emerging and re-emerging infections and outbreaks. Hence, it will help ensure the health security of both the European Union and Africa in this interconnected world. The EU has been a long supporter of global health with strong pharmaceutical sector, and by sharing the risks of new product development with companies in Africa, it can help create sustainable markets, safeguarding a strategically important industrial sector in the European Union. Collaboration in research is another area that will provide additional opportunities for both European and African researchers to achieve greater impact. It is my strong hope and belief that this EU-African partnership will explore all this, including innovative uses of technology, to expand access and to improve the quality of integrated and people-centered healthcare services in Africa, and ultimately achieve the UHC and Sustainable Development Goals we are all striving for. I thank you all.
Thank you so much, Minister Tades, for these very thoughtful ideas and really for already highlighting some of the key investments that, from your point of view, will be important that be taken forward. So now let us get on the ground. Dr. Magda Robalo, you are a fierce advocate for gender, for health. You are convinced, and I know you have been leading over the past months your country's COVID-19 response. So tell us, what is it like on the ground? What needs to be done? How do you think about that gender equality aspect as we have to tackle this type of pandemic? Over to you.
Thank you. Thank you so much for that question. I think the important thing about the COVID pandemic that we are still going through, it's important to remind people that the pandemic is not over. was the fact that for the first time, at least in Africa, we were able to have almost real-time data. And we had disaggregated data. It was not data that was coming a week later or a month later. We had real-time data thanks to technology. And this is something that we need to fast forward. Disaggregated data at all levels. We knew where people were, whether they were children, old, women, or men. That was as little as it might look, so important, so critical for those of us who care about what happens to men and women when it comes to access to services, access to health. But it was also important to note that beyond the pandemic, the COVID pandemic, there was a shadow pandemic of violence against women. There was a shadow pandemic of overwork for women who had to cope not only with children at home, but taking care of sick people at home. This pandemic disproportionately impacted women, and it was difficult to pay attention to details of gender equity. Actually, we realized that after the pandemic, we went back in terms of progress that had been made for women, or for gender, if you want it in that perspective. For the specific case of Guinea-Bissau, and I had the advantage before becoming the High Commissioner for COVID, I was the Minister of Health. I knew the corners of the health system, and I had the opportunity to put in place a gender-balanced cabinet, including promoting some women leaders to lead the regional directorates who became so critical for the response to the COVID pandemic. Just in a nutshell to say, the policies that we had were not gender-friendly, they were not gender-responsive, and now that we are building forward better, stronger, and equal, we really need to make sure that our policies are gender transformative, and when we have the next pandemic, it doesn't find us at the same place where we are today. The fact that we had disaggregated data, for example, when it came to vaccination, we could realize that women were being less vaccinated than men. We organized a quick research to find the reasons why. We organized focus groups with women to find the reasons why they were not coming forward to be vaccinated. And with the support actually from the Portuguese Corporation and Embassy in Guinea-Bissau, Institute Camões and others, we had resources to have a specific approach to vaccinate women. They were not getting to the vaccination centers because they were busy selling. They were busy taking care of the children. They were busy in agriculture. So we took the vaccination tables to where the women were. And then we managed to increase the coverage rate for women. This is just one example of what happened in Guinea-Bissau. We really made sure that we did not leave women behind. I will stop here for now.
No, I think it's really wonderful what you are saying, because in a sense, often we do get questions, I do get questions from companies, what can we do to support and build back better? We are not a pharmaceutical company, we don't. And I think what's very important to understand is that actually it's not about being in a healthcare specialist or in the healthcare business. It's actually what's most important in healthcare is actually the whole other system. As you said, the technology, to be able to understand what's happening on the ground, to be able to detect quickly who has been infected and who were they with. So all of you out there who may be in technology, please come forward, because it's actually very, very important to allow us to know what's happening. And it's really the backbone of this logistics and communication, and very important, because then it allows to have this targeted approach. And I'm very pleased to hear that, because I know at Gavi we have then developed methods so that we have different opening hours for the health centers, for the vaccination, thanks to some of the great data that we get from countries on the ground. The other very important thing, and that is really important to remember, it's actually about, and you said it several times, Monica, it's about opportunities. And you know, in a sense, I'll quote another great colleague, Kristalina, the managing director from the IMF, who did say, health policy and vaccination policy, it's actually economic policy. It's about opportunity, you know, and what can we do actually to enhance that opportunity? So Louis, I'll turn to you as the other banker in the room. So that, you know, based on your, you know, 20-year experience in the area of financial sector, in investing and encouraging direct investment across the world, what can you tell us? I mean, what have you learned from the pandemic? What can banks do? What have they done? And really, what can they do to support, indeed, this recovery and helping us be so better prepared?
Thank you. Wow, that's a big question. First of all, I want to thank Antonio also, that the president of the Portuguese Diaspora Council, for organizing this event. It's a fantastic opportunity for us to develop and deepen the dialogue between Europe and Africa, and no better place to do that than in Lisbon. So why is a banker from Angola doing in a COVID panel, you may ask? I'm not only a proud member of the Portuguese Diaspora Council, but I'm also a European that has been living in Africa for the last 12 years. And I happen to be working for the largest financial institution on the continent. So I've had the opportunity to see on the ground the challenges of growing the continent, of multiplying the opportunities of economic growth, and the positive impact that economic growth brings to the continent. Unfortunately, COVID had a very, very negative impact on the continent. And I think we heard this morning our Minister of International Affairs saying that COVID caused the first GDP contraction on the continent in a quarter of a century. And according to the African Development Bank, there was a 2%, close to 2% reduction. Mm-hmm. So that may seem small in numbers, but actually in 2021 alone, more than 20 million jobs were lost. I was reading a report yesterday from the African Development Bank again, and they were saying that in Eastern and Southern Africa, an additional 30 million children left school because of the COVID pandemic. And this is a disaster in a continent that needs to invest in education, that needs to make sure that foreign direct investment happens, takes place, and helps accelerate economic development. And also this delay, for example, we were talking about immunization. People don't have this notion that COVID had an impact because it delayed the immunization of children on other diseases. And this will have a massive impact in the future. So there are some data points that are not so normal for people to evaluate, but are drivers of economic growth on the continent that have been impacted by COVID. I think from a bank point of view, there were two main concerns. The first concern was an economic concern. The second concern was more pandemic control concern. So first of all, priority was to keep the companies solvent, right? This is really important. Keeping companies solvent protects jobs, you know. So the longer we can maintain companies in operation, the better we can support liquidity. You know, the longer it's going to take for the impact to have its full effect on the economy. And the African economies, they have fragilities, right? So we have to ensure that we give time for governments, for companies to absorb the impact of this sudden and very drastic shock that was COVID. So what banks did, I think, I mean, we can talk for hours, but let me focus on a couple of things. One was moratoriums, so credit relief. Mm-hmm. There was a lot of coordination with central banks and governments to provide clients with moratoriums, so a window for companies to adjust, during which they wouldn't have to repay their loans. The second, I think, focus was on digital and innovation. So working from home, not being able to walk outside and shop forced millions of people to transact digitally. Mm-hmm. And so banks had already started this digital transformation. They had to accelerate seriously investment into digital platforms, digital channels, to enable clients to continue operating remotely. And this, I think, fostered innovation. And so innovation and entrepreneurship are strong drivers of economic success on the continent. And we see more now than we saw before COVID, which is interesting. Then the third one has to do with cybersecurity. Mm. A lot more concerns about, because I'm transacting more digitally, banks are more prone to certain attacks that are happening as we speak. And so a lot of investment in protecting systems, payment systems, protecting data, etc., was also done. And I think, in the middle of all of this, there was a lot of learnings, I think, that we had. And just to wrap up, probably one of the learnings was we need more coordination between private and public sector. There were clearly two independent efforts taking place on the continent that would benefit from greater coordination, and I can talk about that later. Thank you.
No, I think thank you so much for really sharing this experience, because I think your last point of collaboration is key. Indeed, what we have seen through this pandemic is really the financial sector, the private sector coming at the forefront. I was in Davos a few weeks back, actually, with José Manuel Barroso, and what we saw is that, now you have these surveys being done worldwide, and actually citizens turn first to the private sector before the government. The Edelman report, and because in a sense they are really the backbone, and also because it's really about this action that you are talking about. So the effort on digitalization, very important, because in a sense banks are often at the forefront of this, and as you heard from Magda, then that's what trickled down to the other sectors, and it's so important in a sense to be able to know what's happening, how we can provide services better. Having access to early financing, and indeed is critical because it actually saves lives. So it's not just doing the business, but that we have seen, and we have so much data now coming out of this. So really, Monica, Luis, and Magda, thank you for these initial thoughts. So now if we go really in the heart of the discussion, what do you think, from the lessons and looking at how we can further enhance the collaboration between Europe and Africa, what would you say are maybe the top 2 investments that are really needed from your experience and really with the audience here, because that conference is all about this, I'll be very keen to hear. Or you think that, a totally different route, maybe we need to be challenged. We need to challenge ourselves and not wait for a shock to happen. It was Gates Lewis that he said, finally, we needed a lockdown for people to start actually doing digital meetings, using electronic things, and get over the habit. But we don't want another one. How can we challenge ourselves and enhance that collaboration without having a gun to our head, right? I see a few people nodding here. And I'll come to you soon. Huh? This is the immediate panel, but you are actually the key panel here. Magda, please go ahead.
Good. I think the investments that are needed, I will come to that, but they can only work if we change the paradigm. Probably this sounds like we have heard this before, but we cannot continue building on the same soil. If we don't change the soil, things will not be different. And for that to happen, we have people, we have partnerships, and we have the power balance between the people and the power balance in the partnership. If the power dynamics do not change, we can throw billions into this investment we are talking about. Things will not change. We really need, and this is what Africa CDC calls respectful partnerships. We need, talking about health, a new public health order. And in that perspective, there are 3 institutions I would like to mention, institution and a strategy that will make a difference. Africa CDC, Africa Medicines Agency, and the Africa Continental Free Trade Area. Africa needs to do intercontinental trade. Africa needs to develop and leapfrog its industrial development. And Africa needs stronger and more respectful partnerships. And there is another institution we need to talk about here, and that's the International Trade Organization. We need to break a deal on those rules that prevent patents to be transferred so that Africa can also develop its industry. We will be investing billions and trillions if we don't give opportunities for local manufacturing to develop. There will be no EurAfrica new partnerships. The Global Fund for AIDS, Tuberculosis, and Malaria invests billions to fight AIDS, tuberculosis, and malaria. Most of those investments go to Africa. 70% of that money comes back to buy mosquito nets, drugs, supplies, and equipment. That needs to change. And these are the kind of investments, these are the kind of partnerships that we need. And I believe, Marie-Ange, if we don't invest into a different sort of partnerships, we will not be able to transform and be prepared for the world of tomorrow. We heard from the first panel that geopolitics is changing. So if we don't get it in one side, we will look for it on another side. I'll stop here.
No, I think it's really a fundamental point. And I think what's positive in what you are saying, and we heard it from the introduction, the opening remark this morning from the Minister of Foreign Affairs, is that this is starting to happen. I mean, the EU-Africa summit during the winter in Brussels actually was about this, right? The chair of the EU, Macky Sall, telling President von der Leyen, look, we need to have this partnership. And from what we see already on the business side, and that's, again, often business comes before, waiting on all the trades and agreement to take place. But it's a fundamental point. I have to say, really, as an African, I was very proud, actually, during the COVID-19 pandemic to see the EU come together and indeed having a regional response. It was the first time. But again, it took a pandemic, It was the first time having a regional response, creating AVAT, and we are working a lot with them in Gavi to think, okay, what type of vaccines, and now a lot of effort and Minister Tades talked about it, that are being done with the European Union to already starting this local manufacturing. But of course, it's also hearing from the business and making it right. Because sometimes we want to go very fast, but it has to be sustainable. And it goes back to the point Luis was making about that public-private partnership, that is important. So I don't know, any other reflection on that point? Luis,
maybe
please.
A couple of points, and I'm sure that Monica will also want to add. But I think we need to be pragmatic, right? And I mean, for me, it's very difficult to talk about public policy.
Yeah.
I think there are institutions that from whom we can demand more, absolutely. And I think this is a good platform to ensure that some of the decisions that are taken at those institutions are more realistic and have bigger impact on the ground. But I'm a strong advocate of private sector participation, right? And so if you think about the impact of COVID, there are a few things you can do, relatively quickly. I mean, you can have a bigger focus on funding of healthcare infrastructure, right? And we all know that on the continent that is lacking dramatically, right? You can have a bigger focus on training and developing capabilities of African doctors and nurses and medical services people, right? You can have a more assertive view on local production, for example. And I think earlier this morning, there was a very strong argument about Africa needs local production facilities of pharma products, not vaccines, multiple pharma products. And vaccines is important for today, but when COVID is done, we need, more production facilities for other needs, right? And we know there's a lot of needs. So those three topics alone, I think, open endless possibilities for partnership between Europe and Africa that allows for the transfer of technology, the transfer of know-how, and for long-term assets that will be able to transform, the healthcare panorama, right, of the countries on the continent and make them more resilient from a healthcare system point of view to future shocks that are not endemic shocks, because those exist in Africa and continue to exist, but these are pandemics, or these are unpredictable external shocks for which sometimes the countries are not ready.
No, I like the pragmatism. Indeed, I think Magda talked about, we need, the advocates in her said, look, we need to strike deals so that we can operate differently and have the right agreement so that, things can happen. And what you are saying is like, look, we have also to work from the ground and we can do things. Yeah. Let's be pragmatic. And I fully agree, because we have a lot of very interesting stories of innovation and entrepreneurship in Africa. For example, us as Gavi, we helped a few government partners with a drone company. And when I first started the project a few years back, people said, really, a drone company in Africa? Now, in Ghana, they are delivering 24/7 all the vaccines, the medicine, the blood that women need when they have to deliver and you don't have it. And it's actually much more efficient than going by road, because you know what, during the rainy season, the road is not there. So everything breaks down. And so we reduce the time to reach people inside the country from 4 hours on average to 30 minutes. And you know what? Now it's reverse engineering. That company that is from, first they really build only local companies. And now they are doing it, they're starting in the US. So it can happen, and we see this happening, and we have to talk more about it. So I think also a great job of the people in this room, and especially the council on for the Portuguese network, is to help actually that public-private collaboration and also bring back, because you are working in the ground and you know what's happening. Monica, I see you nodding, and I look.
No, to be honest, I don't have much to add besides this point of view. What we are doing now, it's very clear. It's knowledge transfer. It's innovation. That's probably one of the top priorities. And I think that in a way, countries are getting a little bit frustrated with how long it takes to create change. And one of the things that we are discussing now in Geneva, as some of you probably know, it's a new pandemic treaty. Maybe it's not going to be called treaty, it's going to be called an instrument, whatever, but the idea is to strengthen WHO's capacity to intervene quicker and with more robust instruments. And I think some of you also saw that Tedros has just declared public health warning for monkeypox, because it's an alert system. So what we are trying to do in a way, it's also to reshape the health architecture. And that will mean, probably we will need more instruments, but we will sure need that this to be focused on the ground. And this is why I liked so much what Luis was saying, because what we see is that most of the times companies lead the way. We are thinking about, we should do innovation on this side, or we should do innovation on that side. And all of a sudden, the civil society organization comes to us, or a company comes to us and says, well, guess what? We've done it here. Now pilot it, now develop it. And I was listening to you now, Mariangela, and I was thinking, when we decided to use drones to distribute family planning products in remote areas where the rain took the road away. So this is why we need this constant conversation between governments, the UN, and civil society. And I know that Antonio Calçada de Sá didn't brought us here to redesign the world, but I think that this conversation, it's very important, because again, I'm going to say what I've said before. This requires a new partnership, Magda, but it has to be a multi-stakeholder partnership. It can no longer be a partnership between countries. If you just consider how many jobs were lost in COVID, there's no way public sector will be able to restart the economy and to deliver on all those jobs that were needed. If you just consider how many young people we have in the planet, there's no way public sector can absorb all those young people and give them a proper job. So we need that the partnership between private sector and public sector is really strong on knowledge transfer, on innovation, but also on generating jobs. And I know this may seem a little bit far-fetched, but a lot of jobs are related to health. A lot of jobs are related to economy. And just a note, I'm not pessimistic with the fact that some societies are aging. I think, again, it's a reason to celebrate. We live more years than ever. We live with more quality than ever. And this, of course, creates pressure on the welfare systems, but also creates tremendous opportunities for new services, new engagements, new ways of working. So I think, I'm an optimistic by default, and I like being an optimistic by default, because it's often the optimist who sees the solution and not focusing on the problems. But I do believe that in this conversation, it's something that it can really be leveraged. Even these intergenerational dialogue can be leveraged. And this is what I was reacting to.
Magda.
Yes, I just wanted to add that this conversation also has a dimension which is science, and we find ourselves in a science institution. There is an important component in all this, which is related to knowledge. Knowledge generation, use for improving whatever we are doing. There yet, we're still lagging behind. Most research, most knowledge is generated outside the African continent. So we want to, again, invite partnerships whereby knowledge can be generated, science can be produced in Africa together with our partners from Europe. But we can generate local knowledge, apply knowledge locally. And there are, like my sister said before, Africa is 54 different countries, from South Africa from Cape to Cairo. Like we said, there is a huge amount of ethnic groups and different colors and voices and smells. And we also need to adapt our response to the local context, and nothing better than generating local knowledge. The knowledge economy is important as the caring economy that we are talking about. And I can't stop before talking about gender equality. The world is poorer of about 28 trillions if we don't get gender equality. And more than equality, I will also talk about diversity. If I look at this room, and I hope Mr. Alsada will invite me next year, I want to see a different room. I see more men, unless I'm not seeing well, and I'm seeing less diversity. I hope next year we will see more women in the room, and we will see more people from Africa.
But
I hope we'll see more people from Africa, more women in the room. Then we will be talking. Thank you.
But we are starting with the panel, and it's a great point.
The balance in the panel.